everyone. My name is Jennifer. This is my patient Amber. And I'm going to be performing a cardiopulmonary assessment on her. So first I'm going to wash my hands when I come into the room. Then I'm going to assess her carotid artery. So I'm going to start by first inspecting it, looking for any jugular vein distension. There is none. Next I'm going to palpate the carotid artery. And I'm going to do this on both sides. And I'm feeling for the brisk upstroke. Next I'm going to listen to it. And I'm going to listen with the diaphragm and the bell part. Okay. So I was listening for any murmurs, anything like that, any abnormalities. So next, after the carotid artery, I'm going to listen to the heart sounds, and I'm going to listen at the 4 valves. So the first valve that I'm going to listen to is the aortic valve, and it's located in the second intercostal space on the right sternal border. The next one is the pulmonic, and it's in the second intercostal space on the left sternal border. The next valve is the tricuspid valve, and it's located in the 4th intercostal space. And then the mitral valve. So for this valve is located on the 5th intercostal space in the midclavicular line. So I'm going to ask you just to kind of raise up your breast. Okay. So I'm listening for any murmurs in any of those valves. The rhythm, she was in normal rhythm, regular beat, no murmurs, no gallops, or anything like that. So the next part of this assessment, we're going to do the pulmonary assessment. So for the pulmonary assessment, I'm going to first start off by inspection, like I do on the first assessment on anything. So I'm just looking for symmetric expansion of her chest, no trouble breathing, even respirations, not labored or anything like that. And then I'm going to palpate, and I'm going to palpate kind of all over the thoracic cage, and I'm looking for any subcutaneous air, any masses, tenderness, or anything like that. So just tell me if it hurts anywhere, tender, anything like that. Okay. And then I'm going to check for tactile fremitus. So what that is I'm going to place my hand in each of the intercostal spaces, and I'm going to have you say 99. And so we should be able to hear vibrations in each of those. So go ahead and just say 99, 99, 99, 99. Go again, 99. Okay, and then I will do that in the back. And actually, I'm going to turn her. I'm on a scooter, so kind of got to work with that. Okay, 99, 99, 99, 99. Okay, so that's tactile fremitus. And then I'm going to check for symmetric expansion. And I'm going to actually have you turn back around. And we do this on the posterior. And this, I'm going to place my hands and kind of squeeze a little bit, and you're going to breathe in and out, and my hands should expand and come back in normally, not one side over the other. Okay? All right, and there is symmetric expansion. And then for the next is percussion. So we're going to percuss in we're going to percuss your posterior lung fields. So I'm going to have you turn back around. And for percussion, I'm going to place my non-dominant hand on each of the lung fields, and then I'm going to tap with my dominant hand.
Amber, Glenna's on line 2.
Okay. So there was no abnormal sound or anything like that. It has a nice resonant sound. That means it's over air. And then I'm going to auscultate. And I'm going to auscultate anterior and posterior. Let's do the anterior first. And I'm going to do all lung sounds. So when I place my stethoscope, I'm just going to have you breathe in and out. Okay. Deep breath in. Okay. Okay, and then I'll do the posterior. Okay. Her lung sounds were clear throughout. So the last thing that I'm going to do is a series of 3 tests. All 3 of these tests check for consolidation. So if my patient was complaining of a hard cough or I suspected pneumonia, this will kind of tell areas of consolidation. The first test is called a bronchophony. There you go. So I'm going to listen to all lung fields, and you're going to say 99. And I should hear a muffled 99 through my stethoscope. If I hear a clear 99, then that means an area of consolidation. So just say a 99 every time I go.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so I heard all muffled 99s. So she's good there. The next test is called a whispered pectoralquy. Yeah, that's a hard one. I'm going to listen to all the lung fields again, and I'm going to have you whisper 1, 2, 3. So when she whispers 1, 2, 3, as I'm listening, I shouldn't be able to hear it. If I can hear it, then that means an area of consolidation.
Amber, I'm coming up there if you don't pick up that phone on line 2.
Okay, and the last test is egophony, and that's I'm going to listen to all fields, and you're going to say E. And I should be able to hear an E sound. If I hear more of an A or an O sound, then that means a level area of consolidation. Okay, I'll say E, 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 E. Okay, and I heard all E's, no A's or O's, so she is clear there. And this concludes our cardiopulmonary assessment.